Nurse's action doesn't represent all the nurse. It doesn't represent. That being said, that video that went viral of a Caucasian nurse, labor and delivery, I believe. This lady is having baby, an African American is having baby. She's in so much pain, and the nurse didn't even blink. Her main focus was to get her work done. I bet she is the one that gets star, the star in the hospital. I bet she's considered the perfect nurse. I bet she considered the one that's always in everybody ears as the best. You see, the one that does their work, the one that's care, they don't get those stars. They don't get what they want most of the time. They step back and they do their work and care in silence. So we're going to discuss what went wrong in this nurse head. When I see video like this, especially when they go viral and the whole world see how nurses in the U.S. act, they assume that we all in the same bunch. And I'm going to address the person who said on Facebook, I see somebody make a comment, this is racism. Racism. I have to say that with this particular, I don't know if you saw the video or you may have seen the video. Caucasian nurse sit at her desk, and there was an African American in a wheelchair having a baby, practically. She was in so much pain, and just the way she was acting, her mother is there. When a parent is there, that's when you put on your best behavior. You automatically gonna treat the patient well, but when you see family members, you should have got up, do what you have to do, and attend. First of all, a lot of us nurses who care a lot, we don't get those Daisy Awards that the hospital freely give. It's given to those nurses that's sitting at that desk sometimes, that behind the scene administration don't see their behavior, but we nurses, we know. And it's not isolated to labor and delivery, mother baby. It's not isolated. We see nurses like that all around. It's just that they didn't get caught. I am frustrated. I'm not going to claim her as a nurse. Sorry. I see she has a compact license. In a case like that, I wouldn't, the people who want a job and going to do a job, they look at your resume and they automatically assume because you jump around being a travel nurse or you jump around from job to job that you're not a good nurse. But sometimes those are the best nurses that you might find because they've been dealing with situation and stepping in and stepping out and other things. They're able to think critically. I don't understand how someone can sit there, especially how nursing is. This lady is screaming. This lady is crying out. The baby is coming. The mother even saying and edging you on, and you sit there cold-hearted typing at the computer. I don't understand that because for me, the noise alone, my heart would feel her pain. And either I would call a code. I don't care. If I'm sometime maybe, let's give her a little points. Maybe they said she can't leave her station. More than likely not. But let's say that. I'm getting on the phone. I'm sorry. I'm getting on the phone. If nobody showed up in 5 minutes, I'm calling a code so I know that everybody is going to come. They can get mad at me all they want. Why did you call a code? I call a code because this lady needs to get to labor and delivery. I don't care. I'll take the write up. Seriously. If nobody showed up, I didn't see that lady made any effort to comfort the mother. All she was thinking about is finish her paperwork in the computer. And that can wait. Because I would say, I'm going to take you to labor and delivery. And we can do this in the morning when you all settle down. It's just question for insurance and everything. They can wait. The baby's coming. And if I was in a situation like this, say for instance, I was float and I didn't even know where the labor and delivery is. And that's happened sometime. You don't know where different department because you've been working in certain department and you might be a creature of habit. You know one way there, and if you step to the left, you're going to be all confused all over the hospital. I would figure out how to get somebody to come get this lady into the labor room. Call the doctor, do this. She don't even pick up the phone to do nothing. And it was very distressing to watch this video. Because I know a lot of people, gonna have this negative, they already have negative about nurses, the way we dress. Let me not say we, because I'm not included in that dressing. I don't like it either. And we'll talk about that in another video. But this video was very distressing to me. I want to pause for a moment and say this. I appreciate you, those that have been hanging on with me, have been bearing with me, have been struggling with me to keep this channel afloat. And obviously, you thought or you were thinking that I am bringing you valuable information. And I appreciate you. And I don't say it a lot, but I do. Thank you. Thank you for sharing. Thank you for giving me a thumbs up. Thank you. I read that she was terminated. But she has a compact license. Think about that. How can we make this better? Here's a situation that I see that's going on with the nurse. We never know what's in people's mind or what's going on. Sometimes we bring a personal situation at home. She may be the only breadwinner. She may be the one that has all these, she overextend herself. And I'm not trying to make excuse for this particular behavior that this nurse displayed. She needs her job, believe me or not. But sometimes we get caught up in, let's just get our work done, that we are blindsided to what is going on around our surroundings. And I don't know, I don't know if she was working by herself. Where was the supervisor she could have called? Now look at this. Now she's out of a job that she probably needed. Well, a little bit of kindness goes a long way. And another thing that I noticed that in nursing, a lot of African American or black patients we talking about versus Caucasian. I get a lot of flack personally when it's a Caucasian patient that needs her pain meds. She wants it on time. She um she or he, they want it on time, and the doctor write every 1 minute this day. And so if you don't get there within the hour, you may be down the hall because you have 6 patients. Sometimes you have 9 patients on night shift, and you may be down the hall and Mrs. Jones want her meds, and if you don't get there on time, even get there before the meds are due, you're getting a write-up, or you're getting calls from the supervisor. This lady don't, the patient doesn't want you in her room anymore because you this, you, they'll even lie that you didn't give them the pain meds. And then I find myself on the opposite. When it's a black patient, I have to force them. I know you're in pain. You need to take something. And that's the scenario that I see, that a lot of patients, a lot of people, including I'm putting myself in, I don't like these pain meds. And they have this whites think that we can bear pain. We can tolerate a lot of pain because we've been through so much in life. And I think that's what was going on in her head. Like I say, I'm not making an excuse, but I find it different. It's a different action when you working and it's a black patient in pain versus a white patient for me. So I'm thinking in her head, she thinks she's just faking. But to me, like I tell every new nurse, it's better safe than sorry. Even if they say they're not in pain, you know there's a baby coming. And if you had babies before, you know the pain. You get her in there, even if she's early, and the doctor, let the doctor make the decision. You're not the one that's diagnosed it. She's literally screaming if the mother is talking to you. And first of all, with all due respect, there's a family member in the room. She was oblivious to all that. I don't understand. My advice to all nurses, new nurses coming into the field, thinking it's all peachy cream and money, 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 make it rain, money, money, nurse money. I want you to stop and think. Use this word that I use in my household. Treat people the way you want them to treat you. Keep that in your mind. Treat you. I always say it to my kids, treat me the way you want me to treat you. Doesn't mean that you should, if somebody punch you, you should punch back the patient. What I'm trying to say, just the reason why we went into nursing, right? I'm assuming everybody went into the nursing for the same reason, because they asked us the same old question. And what we say, because we care for our sister and we care the family member and we care for them, and it's compassion, and how I'm a caring person. And in reality, you're not even like that. They found that out at the last minute. If you step back, like I've always said, if you have problems, you just, once you hit the nursing, once you hit inside the hospital, you say problems, you're going to sit back. I'll deal with you when I get out here. Take time for yourself, because obviously we bring our stresses to work and then we take it out on our coworkers. Mindful of how we treat ourselves and how we treat others, it won't come off like that. It won't even cause you to lose your license. It won't even cause you, I'm tongue-tied today. It won't even cause you at this time to even lose a job, because now I'm saying now it's going to be more difficult, but then again, you never know, because seems like some people can slide in one door and slide in the next and continue their habits until finally it comes crashing. If you're confident in your ability, if you go in with a caring attitude, when you enter the patient door and you feel a little angry, take a break. I myself, I'm afraid to go to the hospital, honestly, because I know how they treat, some of the nurses treat their patient. I'm so afraid for them, most of us nurses, afraid to say that we are actually a nurse, because we know, oh, don't go in that room. That's a nurse. She's an RN and she's going to ask you all the things. That's the first thing they give you when they giving you a report. Oh, she's a nurse. Miss Know It All. Some of the nurses, that's how they give their report to you. I am afraid to be a patient in a hospital. Don't get me wrong. It better not be a hospital I've been to before. I'd rather go somewhere, Malaysia or somewhere else, to have something taken care of if I have to. My advice to administration, my advice to the DON, my advice to HR, when you're looking at my resume or any nurse resume, because sometimes we travel nurse, we want to get into the local field too. But we're blocked. I say we blocked because it's more difficult for us to get work, because they want us, like I said in my last video, a nurse friend, they want 7 years of consistently working. They might as well say 7 years you've been at that one hospital, you've been a Daisy Award, you've been this, that. They might as well say that before they give you a job. So take a look of her skill, critical thinking, and sometimes the nurses are not, most nurses, the question that they ask, don't assume that everybody can, like, how should I put it? Some nurses are good, they're skilled at passing interview and get the job right away. Not everybody. Give other nurses a chance. That's my advice to the administration or the hiring personnel. I hope you enjoyed this video. I hope you learned something. Have a wonderful day or night in your state or your country. Thank you.